Welcome. My name is Michael Lucido, and I'm a physical therapist, and I am a teacher and instructor with the North American Institute of Orthopedic Manual Therapy, also known as NAIOMT. Today I'm doing a series of videos that will primarily be used for our online education. And I'm using these videos, as I call these, the best of NAIOMT, the best of the North American Institute of Orthopedic Manual Therapy, giving you a taste of some of our different theory and practice that would then give you a sense of where we're going as an institute and whether you'd like to join us or not. Also talking about some of the best techniques of the North American Institute of Orthopedic Manual Therapy of the upper quadrant is, again, lateral elbow pain. One of the things we actually look at is the possibility of the neck being involved with the lateral elbow, and we call that the facilitated segment. The facilitated segment theory was actually created in the late 1940s, early 1950s. It's actually an osteopathic theory that we actually use to this day, and that there are patients that actually do not have a typical elbow complaint of overuse or fatigue. This elbow complaint actually sounds a little bit different. So our examination of the elbow may lead us to think that there's other parts of the body, especially the cervical spine, that could be contributing to the problem. One of the ways we assess that is, as I come around to the other side of the table, looking at Luke's elbow, is taking a look at the skin. And we've already done what's called a peripheral joint examination of the elbow, and we may have had some confusing findings with that. One of the things we can start looking at if we think that the cervical spine could be involved in this is taking a look at skin tone. If I pick up Luke's skin and I am very, very close and around the area of pain, and I'm just kind of noting, again, using the fine part of my hands for a palpation, how thick the skin actually feels as I roll it between my fingers. It actually feels somewhat edematous compared to the other side. I can then go into the cervical spine and do a very quick technique to see if there's a possible relationship between the cervical spine and his elbow pain. So I'm going to get him into what's called a chin cradle hold by bringing my left hand under his occiput and my right hand under his chin, bending my knees and doing a high frequency oscillatory type movement, very, very low amplitude, bringing in some neurophysiological information to the cervical spine, and then reassessing the elbow. And many times, if there is a relationship between the cervical spine and the elbow, when the examiner comes back and palpates the exact same points, you immediately feel a difference in the skin. The skin rolls much nicer, it doesn't feel as thickened, and it's surely not as sensitive.